With an intention to address various health concerns in the state, the Government of Meghalaya had recently taken up the issue of non-availability of essential drugs or medicines and medical equipment across health centers and health institutions in Meghalaya. The Secretary of the Health Department, Government of Meghalaya Ram Kumar, informed that the government has decided on setting up an independent body known as the Meghalaya Medical Drugs and Services Limited, which will also look into logistics and procurement of good quality essential drugs.
So we have set up the Meghalaya Medical Drugs and Services Limited, the agency for coordinating and streamlining the entire matter of drug supply. There are basically three major agendas and one more minor agenda. One is that for streamlining of drugs and diagnostic supply. The second part is taking care of the equipments. Many equipments are there in the facilities, and you have to see training, cost, and etc., maintenance, all of this, these things. And third is that creating this whole online system of doing the entire, from the point of indent to the delivery, everything to be online. The one small other point which is there is the biomedical waste management, which is also an important part of this thing, because we are generating a lot of biomedical waste. It has to be properly disposed of. So we need to see how sub-centers, how PHC, how this can dispose. So these are the main agenda for this corporation, and it has been incorporated, and we are already starting to work, and we hope the teams have been formed, formulated. We are not recruited too many people. Existing people have been already brought into one head, so that we can do this on a very streamlined basis, and so that both the medical facilities with the medical officers, health workers, as well as the public do not face any kind of issues in terms of availability of drugs and medicines and diagnostic tests, at least basics, whatever can be made available. What we are going to do is we are going to bring something called prescription audit. So doctors randomly, we will have a team visiting health facilities, randomly auditing the prescriptions which have been made by the medical facility doctors. First of all, we will see whether it is there, whether the actual, there is a branded drug, there is a generic drug. Whether this drug is available in the pharmacy, why have you not prescribed? We'll have, it's not like an investigation, but it's most like a facilitation to ensure that, people do not go out of the facility for these drugs. So that ensure that they'll be available within that facility. So once we do the prescription audit, medical officers also will be able to know, okay, these are available, that's available. They should be knowing, and we'll ensure that make it to audit, so that people are not unnecessarily harassed to go and buy outside and etc. as much as possible. Of course, there are some drugs which cannot be made a part of EDL, which will be available. Few of them will be there, but they'll not be there. But as our Honorable Chief Minister has announced the budget, there will be also, the corporation will also open this Chief Minister's Affordable Drug Program, where we will set up, through franchising models in terms of outlets in other remote areas where drugs can be made available at very, very cheap rate. This will be in the lines of this Jan Aushadhi Kendra, but it will be more customized for Meghalaya's purposes.